Hello, this is Jennifer Martin. From Healthy People 2020, I chose the topic of older adults in my community for my health promotion project. I worked with the Burlington Board of Health in conjunction with the Council on Aging. According to Healthy People 2020, aging adults experience higher risk of chronic disease. In 2012, 60% of older adults managed 2 or more chronic conditions. Chronic conditions can lower the quality of life for older adults. Common chronic conditions include heart disease, stroke, and diabetes. Contributing factors are nutrition and weight status and decreased physical activity. These 3 chronic conditions are in the top 10 leading causes of death for the older adult population, according to the 2014 National Vital Statistics Report, and are also Healthy People 2020 topics. The Health Promotion Project posters I edited highlight statistics, risk factors, and prevention strategies for these illnesses. I focused on these illnesses because their risk factors can be reduced by implementing diet and exercise changes. I found this quote in my research and it struck a chord with me. The elderly have long been neglected as the addressee of health promotion activities. This idea morphed into the title of my poster presentation at the Council on Aging. It's never too late to live a healthy life. I chose to work with the older adult population after reading Leahy Hospital and Medical Center's Community Health Needs Assessment of 2016. I discovered that the town of Burlington, Massachusetts, has one of the highest percentages of residents aged 65 or older in the primary service area of the hospital. Leahy also reported high rates of leading risk factors in their assessment, with 60% of adult respondents to the survey classified as obese or overweight, compared to the state average of 58%. The assessment also reported that Burlington was one of the towns that had a higher than Commonwealth or county average for 2 or more chronic disease indicators like heart disease, stroke, and diabetes, and they emphasize a need to focus on health risk factors along with primary care management and evidence-based chronic disease management. Based on census data, community commons, and the town's website, Burlington is an affluent, educated town that invests in the wellness of its residents. Community Commons data estimates that per capita income for Burlington residents is $40,795 a year, and that 55% of Burlington residents have an associate's degree or higher. The violent crime rate is also well below the state and national average. Nursing diagnosis associated with the older adult community and chronic illness are deficient community health related to increased risk of premature death, as evidenced by high rates of chronic illness and hospital admissions due to chronic illness. Additional nursing diagnoses that could be used are risk for decreased cardiovascular function, risk for ineffective cerebral perfusion, risk for obesity and being overweight, and activity intolerance for this population. The goal for older adults, according to Healthy People 2020, is to improve the health function and quality of life for older adults. This is a broad goal, so I narrowed down the goal to increasing awareness and education surrounding heart disease, stroke, and diabetes for the community. Some other Healthy People 2020 objectives for older adults are to reduce the proportion of older adults who have moderate to severe functional limitations, increase the proportion of older adults with reduced physical or cognitive function who engage in light, moderate, or vigorous leisure time physical activities. Objectives for heart disease, stroke, and diabetes are to reduce death related to these topics. According to my key informant, Marge McDonald, the director of the Council on Aging, and through researching the town's website, the super system influences that contribute positively to the wellness of older adults in Burlington are services offered by many organizations that include bus service to medical appointments, free exercise and balance classes offered by Leahy at the Council on Aging, meal services provided by Minutemen, and free blood pressure screenings offered by the Board of Health in conjunction with the Volunteer Reserve Corps. Those that impact negatively are related to poor walkability of the town and limited transportation, which hinders access to nutritious food, medical services, and social events. The theoretical framework used was the health belief model. This model theorizes that changing behavior depends on the severity of the potential illness or physical challenge, the level of conceivable susceptibility, the benefits of taking preventative action, and what stands in the way of acting toward the goal of health promotion. Cues are used to remind people about health promotion and preventative actions to take toward improving their personal health. This idea relies on the belief that change can be accomplished, which is why I presented easy changes a person can make to their lifestyle to reap large health benefits using posters, pamphlets, and handouts designed to illustrate these health issues. The intervention used was education aimed at the older adults in my community by displaying statistics, risk factors, definitions, and preventative approaches to reduce the risk of developing or prevent worsening of these diseases. According to Maybach, Abrams, and Morissetts, case study evidence and literature reviews have concluded that public health communication initiatives are on the whole effective in changing people's behavior, but usually only modestly do so, citing reasons for failure related to not having a far enough reach with the message. However, Jameson concludes that the implementation of even one healthy behavior can have ubiquitous health benefit, and although compliance of newly initiated health-promoting behaviors may diminish over time, exercise and dietary changes are the most likely to be modified. I felt this was evidence enough to proceed with my project. Reviewing the literature for diabetes, stroke, and heart disease available online at diabetes.org, stroke.org, and heart.org, the top two risk factors are lifestyle changes related to diet and exercise. In the pamphlets and posters created for the project, using non-medical jargon, I explained the diseases with definitions, symptoms, risk factors, prevention strategies, and when to call 911. I created meal planning guides with lists of foods from each food group, portion size guides, and I included heart-healthy recipes and diabetic-friendly recipes. For physical activity, I printed exercise classes offered by the Council on Aging and exercise recommendations by the American Heart Association. I printed handouts listing day, time, and location of the free blood pressure screenings offered by the Board of Health. And finally, I created a survey to assess the effectiveness of my project with simple questions for the older adults at the Council on Aging. The implications for nursing practice were to determine how to reach the most people and effectively communicate my message to effect changes that are realistic. How do you get people engaged in public health promotion? Recommendations for nursing practice and further research would be to determine why some public health initiatives have an impact and others fail. Also, to improve the tactics that engage the community. There is research around this topic in which Merzel states, achieving a sustainable community-wide health impact remains an unrealistic expectation for time and resource-limited interventions. She goes on to say, improving the significant potential of public health programs requires engagement with communities in an ongoing process of social change rather than time-limited initiatives. In summary, I feel, despite my ambitious effort, that I failed in my objective of reaching and educating the older adults in my community. I was disappointed to find that no surveys were completed when I checked back at the Council on Aging. If I were to do this project again, I would have done an informational session at the Council on Aging to discuss these diseases and their risk factors and prevention strategies, and would have had it be more interactive. My project may have been lost in a sea of information that is already on display there. An educational luncheon with community involvement and participation may have been more attractive and reached more people. Perhaps a contest that involved prizes or rewards for reaching health metrics would be another idea. However, the class timeline and limitations did not allow for something quite so involved. But I will say I learned quite a bit about the challenges faced by the public health nurse. And if this were ever a field I chose to work in, I feel confident of the questions that need to be addressed and the resources needed to accomplish a goal. Before closing, I want to thank you for watching my presentation. And I want to give special thanks to the Burlington Board of Health, the Council on Aging, Susan Luminello, Elizabeth Wallengevitz, Dr. Wayne Saltzman, and Marge McDonald. I have attached my references and the resource material that I printed for the Council on Aging for your review. Thank you.